Hello everyone, welcome to my channel, and today I'm going to give you some idea about the prescription drugs. In my last video, I have discussed the Schedule H drugs according to the Indian Drug and Cosmetic Rules 1945. Today I'll discuss about the Schedule H1 and the drugs belonging to this category. So, Schedule H1 is a specialized subcategory under Schedule H of the Drugs and Cosmetic Rules 1945 in India. Now, why this schedule is introduced means why Schedule H1 is introduced. For combating rising antibiotic resistance and misuse of habit-forming medicines. Schedule H1 was introduced to restrict selling of mentioned drugs. That means habit-forming these drugs like antibiotic resistance, though OTC sales through OTC sales. Now, previously, these were irrationally prescribed by some doctors and dispensed by some pharmacists without the thought of the consequence. So, the Government of India issued Gazette Notification GSR 588E on 30th of August 2013 regarding the Schedule H1 drugs. Now, drugs in Schedule H1 covers third and fourth generation antibiotics, anti-tubercular drugs, and certain habit-forming ones like psychotropic drugs and certain habit-forming sedatives. Examples include high-end antibiotics such as third and fourth generation cephalosporins such as cefixime, ceftriaxone, anti-tubercular drugs, both first and second line treatment drugs like isoniazid, rifampicin, ethambutol, psychotropins, and sedatives like habit-forming such as alprazolam, sedative diazepam, codeine, phosphate, which is used as a cough syrup and which is also used as a drug for substance abuse. Now the warnings. So the drug level should be like this. The RX here, the RX, it should be placed at the top left corner, and here will be the chemical constituents present and the instruction when to take the drug or others. And here comes the warning in the right side in a box with red outline, which is reading as Schedule H1 drugs prescription caution. It is dangerous to take this prescription preparation. It is dangerous to take this preparation except in accordance with the medical advice and not to be sold by retail without the prescription of a registered medical practitioner. Now, the difference between H1, Schedule H and Schedule H1 drugs is that in case of record keeping in case of Schedule H drugs, there should be a normal dispense logbook. But in case of H1 drugs, there should be a specialized logbook and dispense book which should be kept for 3 years and which should be monitored during inspection. In which the name of the prescriber, the address of the prescriber, along with the name of the patient, the name of the drug, and the amount or quantity of the drugs prescribed should be mentioned. And in case of Schedule H drugs, the warning is not to be sold by retail without the prescription of a registered medical practitioner. But in case of H1 drugs, there should be one more thing like it is dangerous to take this preparation except in accordance with the medical advice because it is a strict schedule than Schedule H. However, ophthalmic drugs, drugs for topical use, these drugs covered under Schedule H and these are not under Schedule H1 drugs. And these are some of the drugs of Schedule H1 and there are many more. And here I am ending my today's video. See you in my next video. And if you guys like my videos, please subscribe my channel. Thanks for watching.